low places. Let me get to Chris Howard, Executive Director, Mississippi Department of Rehabilitation Service. Good morning, Chris. How are you, sir? Good to see you.
Good morning, sir. Always great to be on your show.
Well, I thank you so much. Lots of going on. It's been a busy summer for you guys, has it not?
It certainly has. I mean, ever since, well, I say COVID's on the downhill, but it looks like numbers going back up a little bit. But, you know, as we get back into some kind of normal and out there working with businesses and schools, man, we are rocking and rolling.
I got a good guy coming on right behind you. You'll probably bump into him in the green room when you leave, is Dr. Dan Edney, who's our new state health officer. So I got to figure out what COVID is this, what version of it is it, and how contagious it is, and all of that. So we'll get an update from him coming up. Some of the highlights and what's going on with the Department of Rehab.
Yeah, you know, as we close out this fiscal year, like I said, we are really rocking and rolling and getting back in the schools and serving young adults and helping them get ready for employment. And, you know, really what I want to talk to, you know, first part of today was what we're doing with our special disability programs. And, you know, we're helping individuals with what we say significant disabilities live at home. You think about that. You know, if you have a significant disability, or you know, if you have a family member with a significant disability, you know, wouldn't you much rather have them at home with you as opposed to, say, living in a long-term care facility? So, you know, through the work we're doing, I looked at this yesterday, we paid over 5 million hours to personal care attendants to help nearly 4,000 folks stay at home.
Wow.
So you think about that. I mean, 4,000 Mississippians were able to live at home with their families, you know, as opposed to living in a long-term care facility. So,
a lot of times when that happens too, Chris, people don't know where to turn. They have no idea. But that's why we do this program, to let people know that if you have, you know, your mother, father, grandparents or something, and they don't want to be in a long-term care facility, you're talking about things like, we were talking about wheelchairs or things that help them with some mobility. But there's a wide range of things you guys do that are very, very costly and almost sometimes unaffordable.
Yeah, because, you know, when we talk about these 5 million hours that we paid for personal care attendants, you know, also into that, to keep someone at home, you may have to do a home modification. Right. You know, maybe you have to do a roll-in shower or grab bars or lower countertops, widen doors, build a ramp. You know, as we have an assistive technology division, as you know, and you know, when we go into someone's home, they look at it from front door to back door and really look at that house and say, okay, what needs to be done to keep that person safe in their own home.
And many of the homes, certainly some of the older homes, are just not built to those specs.
That's right. You've got a lot of, say, mobile homes, or if you're on the coast, a lot of houses off the ground, and you've got to look at, you know, ramps. You know, prior to someone having a ramp, maybe individuals had to help carry them up the front steps to get in their house.
How did you guys negotiate that with all of the people that you have going out across the state and being able to go into these homes? You know, I know you had the mask on and you could take care, but sometimes people didn't want anybody in their homes.
Yeah, to be very honest with you, in the middle of COVID, you know, we had individuals who needed our services, but honestly didn't want us in the home. They didn't want our case manager and our AT guy and a contractor all in the house. So unfortunately, we had to delay some of those until individuals felt comfortable for us to come into the house.
What do people need to do, first of all, if they think they meet those objectives and they can clear? What's the first step to get that done?
There's two ways
to get some assistance.
Yeah, there's two ways to do it. You can call our 1-800 number, which is 1-800-443-1000, or you can go to our website, which is mdrs.ms.gov, and in the upper left-hand corner, it's like location services, I believe what the tab is. Mm-hmm. You click on that and type in your town or your county, and it will pop up what is the closest office in your area.
So you don't have to come to Jackson. I mean, there's going to be an office somewhere closer to you if you're outside the Jackson area.
Yes, sir. Yeah, we've got 45 offices around the state. We cover the whole state, you know, through those 45 offices, and we're from Corinth down to Gulfport, over to Natchez, across the Meridian. So we're covering the state.
Chris Howard is Executive Director, Department of Rehabilitation Services. Chris, is there a entry level as far as of your household income?
No, sir. No, not for this program. You know, we just document the person has a need, has a disability, and again, our counselor will work with that individual, create a plan of care, and AT will go out. And also, let me say this, we did nearly 300 home mods this past year, and honestly, we could have done more. But our problem we're seeing right now is finding contractors. there's just not enough contractors around the state to do this job, and that's one of the reasons I'm really excited to be on your program today. Hopefully, if you've got contractors out there listening, we would love to talk to you all about maybe helping change someone's life or lives through this process. So, when you look at our program, a contractor has to, of course, be a licensed contractor. They have to have $100,000 general liability insurance and 2 references. But these are usually bathroom modifications, kitchen modifications, and again, you're truly changing people's lives, as we go in and modify these homes.
So you put your name on the list at the Department of Rehab, and then you bid for that particular one, or what?
That's right.
How's that
we
work?
go through the purchasing requirements that the state requires. So anything over $5,000, we have to have 2 quotes. Anything over $50,000, I think it went to $75,000 if I remember right. But that has to be legally bid. So we do follow the purchasing requirements. And again, it's just trying to find good licensed contractors around the state to help us do this work.
Well, who's going to turn down that business, especially when the government check's going to clear? So I think you're right. It's just a lot of people don't know about it. But if you're, would those be 2 different things there for the most of them, plumbing and then the carpentry, or is you're looking for a contractor who can handle the whole thing?
Yeah, we look for contractors who can handle the whole thing. So again, our assistive technology folks will go out into the home, create the specs, and then we put those specs out for quotes or bids, depending on how much it's going to be. And then we wait for the contractors to provide those quotes to do the entire project. Yes, sir.
Some of those jobs, you said $75,000 and more. What does a job like that cost for the most part?
That's very rare. Usually a home modification is anywhere between $15,000 and $30,000, just on average, depending on what needs to be done.
Again, all that information is on the website, so go there and I guess just put your name on it and you'll be contacted.
That's right. Because again, there are so many really great stories out there that there's a story I've heard that I tell sometimes of an individual in rural Mississippi who, at the time did not have a modified home, and this individual was actually bathing outside. You think about that. We're in the year 2022. And we still have some of our fellow Mississippians who can't access their bathroom. But when they got the referral to us and we went in and modified the bathroom, put a roll-in shower, and then that individual's able to take a shower, take a bath in their home. So
I do remember talking to you before, but also hospital beds are some of the things that they may need.
Yeah. Through our Project Start program, that is a loaner program, so to speak, and we can loan equipment out to individuals who need that desperately need that.
You have all of that stock here as far as inventory is concerned, or they have to ship it from somewhere else?
No, we've got some here at our office in Madison, and then we've got a warehouse that's got a lot of equipment as well.
If you have someone who is again anywhere from hearing difficulties, blind, there are so many different services that are available from the Department of Rehab. It's there for you, and every time we do this, we get some feedback. People say, "I didn't realize that was there," but that service is there. And when you talk about that 5,000 hours being paid for, most of that, if not all of that, is coming from the federal government, is it not?
That's right. Yeah, over 80% is coming from the federal
80%?
Government. Yeah,
so that's a pretty good deal.
And I'll tell you another cool thing is, we do studies that, and so does Medicaid. The cost of serving someone at home through one of our waiver programs is, I'm throwing this number out, I can't remember, it's around $20,000 maybe, less expensive to serve someone at home as opposed to a long-term care facility. So not only are we keeping families together, but we're also saving taxpayer dollars by serving people at home.
How many did you say you have now that you're serving in the state?
Roughly 4,000 are being served on that program.
Wow. Altogether, how many people do you serve in the state from all the services?
When you look at all of our programs, it's close to 100,000. 100,000 folks come through one of our programs.
100,000 Mississippians total.
Yes, sir.
You got time to stick around for a minute?
Man, I'd love to. I got a lot to talk about.
Well, let's do that. Chris Howard, Executive Director. Live from the Trustmark Studios, retirement planning will fit your plans to a T. People you trust, advice at work. Streaming live, SuperTalk.fm. Of course, SuperTalk TV, channel 70 on C-Spire TV. Roku, YouTube, and just about everywhere else is where we are available. Chris Howard, who's the Executive Director, Mississippi Department of Rehabilitation, and he's done a show prep here, so he has his talking points. There are 1,000 different areas I could go, but I want to make sure you covered what is topical. So go forth, sir.
Okay. Yeah, the next thing I want to talk about is something we're really excited about at Department of Rehab, and that's Project Search. Project Search is an international program. It started about 3 years ago in Mississippi. But what it does is it works with a school and an employer, excuse me, and the kids who are in their last year of school with intellectual disabilities are able to go to a host site, which is an employer, usually in a hospital setting, and they do at least 3 different internships over that 9-month period. So, these young adults, instead of being in the classroom, they're going to this host employer, and they're gaining valuable work experience, whether it be soft skills or hard skills. We just finished about 13 sites, and we're going to 18 sites this next year. And we serve 50 kids, 50 young adults, and we're going to bump that up to almost 100 this year. But again, it's really a great program because, you're talking about young adults who aren't going to be going to college, but are able to go to this host employer, gain valuable work skills. And of the 141 young adults who've been through this program so far since we started it, 95 of them have gained jobs after they got out of it. So,
how about that?
We're almost at 70%.
Can you give us some examples of this as far as the disabilities or the type of industries that they're working in?
Yeah, so these are young adults, again, with intellectual disabilities. They're in their last year of school. And they're going, say, to University Med Center has been a great partner. They were actually the first one to come on board when we started this about 3 years ago. But these young adults are in different areas like radiology, patient transportation, medical records. The Hattiesburg location we did, one young adult was able to work in the IT department. So it's really some great jobs these young adults are learning. And, the studies have shown that a lot of them are gaining employment once they get out of this internship. And, we do a graduation for each one of the sites in May. And to have parents come up to you and say, thank you for what you're doing. Thank you for this program, because we didn't know what our young adult was going to do once they got out of high school. Yeah. But now they've got these work skills. Now they're, a lot of them are finding actual jobs. And the ones that haven't, our business development are still working with those young adults to help them find jobs. So just because they don't have one now doesn't mean they won't have one in the near future. Cause,
how early do you start on that?
Again, they're in their last year of school. So
in the last year.
Right, yes.
But
sir.
I mean, I guess what I'm saying is, the year before that is when you start laying some groundwork to contact you guys and find out more information? Or
that's right. Yeah, because, really through our vocational programs, we talk a lot about our vocational programs, but we can actually go into schools and serve young adults as young as 14 years old. So we're working with the teachers, we're working with the school districts and providing what we call pre-employment transition services. So we're helping those young adults, with job exploration, job readiness, self-advocacy, so to really help that individual kind of know what's out there and what they want to do with the rest of their life once they get out of school.
Is this autism? Is that in the category?
Yes, sir. Yeah. A lot of the individuals we serve are on the spectrum. And I'll tell you, it's not a large percentage of the total caseloads we're doing, but it is a growing percentage. So, as we're out in the schools, we are reaching a lot of young adults who are on the spectrum.
We don't think about this, but there are quite a few in our state as far as the are blind or near blind. So that's a whole new facet there.
That's right. Yeah, because when you look at our vocational programs, the definition of a disability is any disability that is an impairment to someone maintaining or obtaining employment. So, everybody recognizes, of course, blindness, deafness, a person in a wheelchair, but, you may have an individual who has severe anxiety. You may have a person who has ADD, or maybe they're in their secondary treatment of drug and alcohol. These are all disabilities that could be an impairment to a person maintaining employment, and as a result, we can serve individuals to help them reach their employment goals.
That's called the SEARCH program?
Yeah, well, the SEARCH deals with young adults, yes.
I got it. All right. That's just another fact. If you go to the website, there are about 20,000 things like that, so you'll find something that's tailor-made for you. What else is going on?
Yeah, I tell you, I was driving over here thinking, golly, what do I want to talk about? There's so many great things that are going on in our agency. How can I hone this down to 20 minutes or whatever time you give me this morning to talk about it?
You got it. Go ahead.
But we talk about it, a lot in the past, our vocational programs, and these are assisting individuals again with helping them reach their employment goals. So, if you've got listeners out there who have a disability and want to go to work, or maybe they obtained a disability later in life and are in fear of losing their job, we can sit down with those individuals and help them reach their employment goal. And everything is individualized. You come in, you can meet with our counselors, and our counselors, one of the first questions they're going to say is, what do you want to do? What do you want to do with the rest of your life? Do you want to work in hospitality? Do you want to work in manufacturing? Do you want to be an accountant? It's whatever that person wants to do, and then we create a plan to help that person reach that goal of employment.
And we talk about the money, of course, is certainly important when somebody becomes self-sufficient. But boy, just to be able to work and to have that value, that is an emotional and psychological help that's almost as much as the money.
Yeah, I'll tell you, studies have shown that when you hire an individual with a disability, they're a lot more loyal to the company than, say, a person without a disability. And, you think about this job market right now. People are jumping job to job all over the place because there's so many vacancies. But, when you invest with a person with a disability and provide that training and opportunity, that person's going to be loyal to you. And, I'm an accountant, so I like to throw numbers out. But, we work with InSpark through Mississippi State, and they do a return on investment study for us. And they actually showed that, it's a 2.8% return. So for every dollar we get in state funding to put a person back to work, the state gets their dollar back plus another $1.80 through state income tax and reduction of public benefits. So it is a program that pays for itself. So not only are you helping that person, helping that family, reach that employment goal, but it's also a great program that gives back to the state.
Well, Chris, with the supercomputers Mississippi State has, I will not challenge those statistics at all. So there you go.
Well, being a bulldog, I believe everything they tell me. So.
Ability Works is one of the other places, things you have. And I was going to ask you about the Mississippi ABLE. I'm looking at that on the website. What is that?
Yeah, well, I'm glad you asked me that. That is something we have been charged with through the state legislature. We administer that program along with the assistance of the state treasurer's office. And it's a program to assist individuals with disabilities in saving for the future. So, if you're a person with a disability, and let's say you're on public assistance, you cannot have more than $4,000 in assets, or your Medicaid gets cut off. If you have more than, I think it's $1,000 in assets, you lose your Social Security. So, through Mississippi ABLE, you're able to put roughly $15,000 a year into this what's called an ABLE account with a maximum balance of around $250,000, and it does not go towards those asset limitations. So,
wow.
So you're able to save for the future, not be concerned about losing your public benefits. And it's just a great opportunity for individuals to save for a roof or save for a new piece of technology or a car or what have you. But another thing I like to point out, too, is, we've got a lot of parents and grandparents with young adults with disabilities. And, you hear all the time, how can I save for their future, without them losing public benefits? So, parents and grandparents can put money into an ABLE account for their young adult. And the really cool thing in Mississippi is the contributions that go into a Mississippi ABLE account are state tax deductible. So, if a parent puts money into that ABLE account for their young adult, not only are they saving for that young adult's future, but they get a state tax deduction as well.
And then, that's incredible. Yeah.
Well, I know right now you can't really talk about gains, when you look at the market, but, any earnings earned off the ABLE account are tax-free. You don't have to pay income tax on the earnings that you earn on an ABLE account. So it's it's protected and it will not penalize you, as you said before. That's correct. So, and the way we set up in Mississippi, you can do a debit card or you can do an actual investment where you can be aggressive, you can be conservative. We've set it up so, it's a great way to invest based on what you feel your risk is. Everything is there. You want more information, go to the website. The website is mdrs.ms.gov. Always good seeing you, my man. Yes, sir. Always great to be on. A lot of things going on. Look forward to the next visit. Chris Howard, Mississippi Department of Rehabilitation. Look, check it out. There's lots there, and